Welcome to Integrative Oncology Talk, where we discuss the latest science and opinions from leading voices in integrative oncology. Integrative oncology utilizes complementary therapies and lifestyle strategies to help those affected by cancer, using personalized approaches and evidence-based recommendations. This podcast is hosted by Dr. Santosh Rao, a medical oncologist and integrative oncologist, and Dr. Judith Lacey, a supportive care and integrative oncology physician, with support from the Society for Integrative Oncology, an international multidisciplinary organization whose mission is to advance the science and education of integrative oncology worldwide. The views expressed on this podcast do not necessarily reflect views of the participant's workplace or SIO and are not meant to offer medical advice. The information, opinions, and recommendations in the podcast are for general information only. Before making any changes in your healthcare or lifestyle, please discuss with your healthcare provider.
So I'm delighted today to be speaking to Jerome Saris about the role of psychedelics in managing mental health and the potential application for patients living with cancer. And so let me introduce you first of all to Jerome, and then we'll start our chat. So Jerome Saris is an Australian Government National Health and Medical Research Council Research Fellow. It's a mouthful. It's called the NHMRC, and Professor of Integrative Medicine, Integrative Mental Health. He currently leads the Healthy Minds research theme at the National Institute of Complementary Medicine, NICM, Health Research Institute, and is the co-director of Psyche Institute, which can be pronounced in many ways. And this is an institute which studies psychedelic medicines in Australia, and he'll tell us more about that. Jerome moved from clinical practice to academic work, completing a doctorate at the University of Queensland in the field of psychiatry, with a particular interest in anxiety and mood disorder research pertaining to plant medicine research, including psychedelic medicines, medical cannabis, and kava. He gives a really interesting talk on kava, but that's not the topic today. And he also has an interest in lifestyle medicine and integrative models of care. Professor Saris has over 200 publications and has been involved in dozens of clinical trials with integrative medicine field. And I am just very excited that we finally coordinated a time that we can talk together. And we're really going to spend a bit of this time exploring this role of psychedelics in this new and exciting space in mental health, and how we can potentially look at the role of psychedelics in the mental health of our patients living with cancer. So, look, I'm going to start, Jerome, in a place that I like to start with many people, is just tell us a bit about why and how you became involved in integrative medicine for mental health, and particularly some of the work that you've done, and then why psychedelics?
Yes, look, it's great to be with you. Thank you, Dr. Judith, for the invitation. And yes, it was a Christmas or a Festivus miracle that we managed to get a time together, both being fairly busy. So thank you. Yes, look, gosh, I would say, first of all, I was initially inspired, or at least it captured my imagination, the potential therapeutic application, the power of plant-based medicines. Back when I was a teenager, I remember reading books around various psychotropic plant medicines. I mean, gosh, it was over 30 years ago, and just found it fascinating, the effect that people could consume plants and they'll have therapeutic effects and change your brain chemistry and have quite potent effects on the brain. And then that, I guess, sort of promulgated a journey towards researching this particular area, doing qualifications across the integrated medicine field more broadly, doing some clinical work, and then going into academia after a certain time, having an interest besides integrated medicine, or I should say within integrated medicine, looking at lifestyle approaches, nutraceuticals, and plant-based medicines. And I would have to say my primary passion has always been psychotropic plant medicines, and we've obviously been doing increasing work with medicinal cannabis, and I think that's also moved the field forward towards exploring other plant-based medicines and other substances within the field, pertaining to psychotropic plant medicines.
So when you talk about psychotropic medicines, can you explain sort of what that is and what this field is, and a little bit maybe about your the work that you're doing in your new institute around psychedelics and mental health?
Yes, well, I guess the listeners would be aware of the classical psychedelics, LSD, for example, psilocybin from the psilocybe or magic mushrooms. There's also mescaline from peyote is another example, and ayahuasca, which contains DMT and some Humala alkaloids, which I'm sure we'll talk about soon. But there's also MDMA, within, I should say, the field more broadly. It's obviously an amphetamine-based compound, an empathogen, and then also more broadly, you could also consider ketamine, a dissociative analgesic, as sort of part of the broader field of psychedelic research.
So then how do you know, so I guess what are you studying at the moment? What catches, is it all of these psychedelics? I mean, which ones are the ones that are the real focus in mental health? Is it all of these, or is it, one particular agent?
Yes, well, I suppose, I don't want to say the word or the phrase "pick your poison," because that's absolutely not how we want to describe. But really, it just depends, of course, what the condition is, which people are researching it for. I think that there is, or I should say firstly, that these particular interventions or these agents can be used across various psychiatric disorders. But at the moment, the way things are shaking out, psilocybin has been studied a fair bit for depression and also treatment-resistant depression. I mean, there's a scope to use it, for example, with anxiety disorders, potentially for trauma. MDMA has focused more on PTSD as an application, but once again, I mean, there's the potential to use that for other disorders. Ayahuasca or DMT, certainly in our data, which I can talk in more depth soon, there tends to be supportive use, at least epidemiologically, and there's some emerging clinical trial evidence for depression, for improving mood, but also for trauma and substance and alcohol use as well. Now, LSD was studied ages ago. I'm sure listeners may be aware the studies in sort of the 60s and 70s, and then I should say probably early 70s, and then the prohibition kicked in. And then, so it hasn't been studied, obviously, since, although there is some research starting to happen with LSD.
Yeah, and so what is it about the psychedelics that, like your work maybe with ayahuasca, that makes it so intriguing to look at why it can improve mental health and depression? Can you tell us a little bit about the mechanism and why?
Sure. Yeah, absolutely. I mean, people do ask that. They say, well, haven't we got all these other pharmaceutical medicines? Haven't we got psychology? Isn't that enough? But the reality is, if you look at the data, especially, well, I'd like to say post-COVID, but I don't even know if we can say, I suppose peri-COVID, that we've just got such a mental health onslaught, an issue in society that certainly COVID obviously hasn't helped. And in terms of our treatments, while we do have a range of effective treatments, they're not always effective for people, and they may not have full symptomatic relief. In some cases, people may be treatment resistant, or they'll just get too many side effects if we're talking about particular pharmaceutical agents. So we do need, what I like to say, just to paraphrase the Jaws movie, we need a bigger boat. And I started my research focusing more around the herbal medicines, the nutrients, general lifestyle approaches. And the one thing which really occurred to me, especially when trying to use these agents for serious psychiatric disorders, be it an anxiety disorder, depression, traumas, psychotic disorders, you name it, that you do feel that you do need a bigger boat. Now, that's not to say that these integrative therapies aren't effective or should not be considered within an integrative paradigm, because I think they should be. I think they can have fantastic effects on managing certain symptoms, used in combination with lifestyle approaches. I think is absolutely the way to go for many patients. But there are some disorders, there are some psychiatric disorders which people do need a stronger neuropharmacological effect. Some medicines will address that, but for, as I said before, some people that just isn't effective, or there's issues with side effects. And then along comes certainly over within the last decade, increasing research on some of these psychedelic agents and showing really quite potent results. So it's really inspired a new generation, a renaissance, if you like, of psychedelic researchers. But I think the difference between what's happening now and back in the sort of the 60s and 70s is that medicine has advanced as well as our psychotherapeutic techniques. So we can do the sort of research we need and set up the clinical models and have the medical care to treat these agents seriously within that framework and for them to be used as bona fide medicines.
So if we take, say, the example of, I work with, the common antidepressants we use, the serotonin uptake inhibitors or the noradrenergic or the monoamine, we know our antidepressants have developed based on receptor activity, but there's something different about psychedelics, isn't there? And if you take psilocybin or ayahuasca, can you tell us a little bit about the mechanism of action, perhaps, and why this is a potentially a more therapeutic, a new therapy with a new approach and a new way of viewing how we manage, say, depression or anxiety or PTSD?
Sure, absolutely.
I guess, was that a long-winded answer? Tell us about the mechanism.
Mechanisms of action. There we go. Yeah, definitely happy to clarify that. So, I guess the easiest differentiation, if you look at antidepressants, I mean, they'll be, I guess, what you describe as silver bullet, or at least they attempt to be sort of silver bullet medications modifying a particular serotonin receptor, or as you said before, being, for example, a serotonin reuptake inhibitor. So with psychedelics, the classical psychedelics, at least, they'll bind with the 5-HT2A receptor, but also, they may have a preference for 1A, 1B, and 2C, other examples. So they do have a range of different effects, but beyond that, you're also looking at anti-inflammatory modification, brain-derived neurotropic factor, and neuroendocrine modulatory effects, depending on, there's a range of other substances to go on and on about it, but they work also on other pathways. Might be the, NMDA or glutamate pathways. Some of them may also have a role with affecting dopamine pathways as well. So they tend to have a broad range of effects.
Yeah.
And I think that's what they certainly do differentiate themselves, for example, with classic antidepressants.
So people will talk about out-of-body experiences, this neuroplasticity effect, and that the whole the use of psychedelics is actually an experience rather than a. Can you talk a little bit about this guided psychedelic experience as therapeutic versus taking as an antidepressant, anti-anxiety in microdosing, or how we understand that, how we can understand that a little bit more?
Yeah, absolutely. And I think that's what differentiates it. And this is what I think is quite exciting, is that it's not just about targeting an isolated receptor and that's it. If you look at the effects on neurocircuitry, and that is where neuroscience has certainly been trying to lead us more towards, is to look at the brain, the interconnectivity, what's happening between brain regions, communication on more of a macro level, and how that interfaces with consciousness, as well as obviously mental health or ill health. For example, with psychedelics, they dampen what's known as the default mode network. And when the default mode network is activated, the circuitry in the brain, you get increased rumination and introspection. So the person's going around in their mind, they're ruminating. And this happens with a range of psychiatric disorders. You think about rumination, for example, with anxiety and depression and trauma. So in a sense, it diffuses that, dampens that. And, as a way of illustrating the psychological effect, person from experiencing psychedelics may, be able to move outside their own personal narrative, which in some cases might be, very negative, that they conceptualize things more broadly, their connection with other people, with understanding existential concepts on a deeper level. For want of a better expression, connection with the universe. Some people may find the experience very mystical. Now, when it comes in regards to framing that, for example, in the context of cancer, cancer survivorship, and also people dealing with either through palliative care or the concept of potentially their own demise, that to have these experiences, I think, within a therapeutic framework supported by, for example, a clinical psychologist, doing preparatory sessions towards this, taking this particular agent, having this profound experience. People describe it as an increase in awe, greater connection, or connection to something greater than themselves. This sense of ego dissolution, or increase in what they call sort of oceanic boundlessness, I think is a very profound experience for somebody who is experiencing cancer or palliative care, or going through that end of life challenge. So these sort of therapies are very powerful, and you can't get that from any other standard drug.
And that's what I guess is really interesting in some of the studies being done in that end of life space, or people with eventually fatal disease and dealing with that existential angst and distress about, oh my God, I'm dying, how do I deal with this? That the idea that you can have a one-off or a couple of sessions as a psychedelic guided therapy, and actually that therapeutic benefit is long lasting. I mean, that's quite different from other antidepressants or other psychiatric medications, isn't it?
Exactly. And it's not a very good pharmaceutical model.
So we're just going to recap a little bit and take a step back. And I was asking, I guess, the question of this really comparing that psychedelic guided maybe 2-session experience that they're doing studies with in people near the end of life versus the classic way antidepressants, antipsychotics, anti-anxiety medications are used, and a little bit about this really interesting way of using psychedelics therapeutically. And if you want to just talk about that.
Yes, well, it is a different type of treatment model, and one could argue from a big pharma perspective, probably not a great model. If you can get people having strong response and potential remission with 1 or 2 treatments, But look, that being said, I mean, for some people, look, it could be a case of 1 or 2 sessions, they're in remission and that's it. We don't have enough long-term data. My sense is that it may be something which, over time, people will have repeat sessions. It's not just a case of take one and you're cured for life. As we know, psychiatric disorders, they can change and morph, and new things can come up, and you can get people having episodes triggered, and so forth. So yes, it's a completely different model. The treatment may be over, for example, a 1-month period, could be several months. I mean, there is obviously preparation involved in terms of the psychotherapy, as well as afterwards for the integration of the experience. So that is important. But I think it does hold promise in terms of treating more substantially than a medication. And another key point is that it's been described, in a sense, to have a different therapeutic goal. If you look at antidepressants in the context of depression, in a sense, we are looking at band-aiding. We're looking at dampening, which for some people, it is important. But at the same time, when we contrast that with psychotherapy and psychedelics, the person is, in a sense, especially if you're looking at a treatment such as ayahuasca, confronted with a particular trauma or substance use issue, depression. They're supported while they go through that, but it's something where they are processing that, and that may also take them back into formative experiences through childhood, which link into that, and that provides the context for the insights which they will hopefully achieve, which could be transformative. So completely different model.
And that's really interesting, I guess, in the cancer space, when people are confronted with an acute traumatic experience such as cancer, which may or may not have an ability, they may or may not have the ability to return to the life they once had, or they are pushed into the facing the end of their life, trying to make meaning out of the experience and the distress that it's caused, or it seems like, and I guess that's why people are so interested in the cancer space, it seems like a really amazing tool to enhance psychotherapy and enable people to take that step forward, to actually re-engage with living or find pathways forward to make sense of where they're at.
Exactly. And that is the key point, I think, is to make sense of it, to understand it, and to get meaning. I think in that context is critical.
Which makes you rethink about defining mental health. I mean, is it only for people with DSM, whatever number we're up to now, 5, 6, I don't know,
yes.
Mental health conditions, or is it something that can be used in people that just really want to explore further, understand further, develop their ability to cope with a diagnosis of a life-limiting illness?
Yeah, and I think as a society we need to have a mature conversation around that. My thoughts are that initially the critical steps forward concern safety, concern optimizing treatment models, also more robust scientific inquiry around the efficacy of these agents. But I think once that's established, then the natural attention, I think, goes towards greater existential issues in terms of consciousness, exploration, meaning in life, society as a whole, and the effects that these agents could potentially have. If it makes us people who are aware of ourselves more, our faults, things we can improve, we can be kinder to each other, hopefully, and in the world, not to put too much of a hippie spin on it, but hopefully the world can be a better place. So I think, look, there is there are larger questions and larger issues which we can grapple with, but immediately I think it really is the medical focus which we are addressing.
And so if you're taking the example of PTSD, is that okay if I use that as an example?
Sure.
Yeah, so PTSD is something that I guess psychedelics have been used in, and I don't know which one, so I'll leave that to you to maybe comment on it. If have been used to enable people to relive some experiences, even come to have near-death experiences in order to move forward, to re-engage with being able to live more fully. And people will often say that people with a diagnosis of cancer may experience PTSD. So do you want to talk a little bit about just how they're used in that space in a therapeutic way, which is a really horrible thing, difficult disease, condition to live with, I guess. Yeah.
Yes. The work in this space has largely been headed up by MAPS. We're in America using MDMA, and they've got a treatment package around prescribing MDMA. There's been some very positive recent phase 3 data showing that it is effective quite stunningly in reducing people's PTSD symptoms. So that's not to say that psilocybin may not have a role, and with our epidemiological data, which we've been publishing through Psyche Institute. This was led by Associate Professor Daniel Perkins through the GAP study, the Global Ayahuasca Project. It did show that people using ayahuasca reportingly for trauma and PTSD-based conditions do report it does have a very strong level of success in terms of addressing those symptoms. So there are, I think, emerging data, more so in the MDMA space, and absolutely that is a potential role for these agents.
So where do they fit in? Do they fit into standard psychiatry? Is this integrative medicine?
Well, it's a good question. I think it's a question for policymakers, regulators, in regards to where it sits. We don't really get involved with Psyche too much in the regulatory advocacy part of things. We just tend to focus on the science. I guess what I can say is that, it really depends on the jurisdiction. There are some jurisdictions in America where it's legalized and it's a free-for-all, and we certainly, I think we recognise there's a whole raft of concerns about that approach. At the same time, some jurisdictions may be highly restrictive and prohibitive, and people who ideally should be potentially exploring use of these agents under the care, for example, of a psychiatrist and or psychologist, aren't getting access to them. So it's about, I think, finding a judicious path forward. And also, like in many cases, I think sort of what happened with medicinal cannabis, catching up the research. And that's why I think, we're really trying to drive the research forward as best we can, because we don't want to be, stuck in a situation where, like with medicinal cannabis, perhaps it does start to get opened up, but then, we don't have the data to support what it should be used for whom should be, who should be using it, and in what circumstances.
Yeah, I've been talking in this space a little bit, and I work obviously quite a bit in medicinal cannabis, but also in integrative therapies, and looking at how patients with cancer generally cope, the various benefits of different therapies, and how actually to make this experience meaningful, and the impact of what's going on physically on your mental state, and vice versa. So for me, I think it's quite an interesting development in expanding our toolbox on how we generally care for people living with cancer, but also people living with mental health issues.
And carers as well. I'm not unfortunately liberty to too much in depth, but we've got an association with a wonderful group up in Queensland who is looking at doing work in regards to supporting carers, in the cancer space.
With psychedelics.
Yeah, with psychedelics. Yeah. I can't give away too much detail because of confidence, but except to say, we really do need to think more transpersonally, more broadly, because we know the damaging effect of cancer on the family unit. So we also need to support people going through these particular conditions. Psychedelics, may be, another consideration. If we can do some research around that, especially if you've got very aggressive cancers, which can take away loved ones very quickly. It's a case of also addressing the aftermath of that.
So psilocybin is probably the most popular psychedelic that is being talked about, because you can go out in the fields and hopefully pick the right mushroom, but hopefully. But
either that or die. Yes, that's right.
So not recommended. But why psilocybin? What's so magical about this magical mushroom?
Why psilocybin? Gosh. What is good about it, so for example, in the context of magic mushrooms or the psilocybin mushroom, is that we know in this case, okay, what is the active constituent? There are other alkaloids and other compounds in the psilocybate, but we do know this is the psychoactive or major psychoactive agent. So we can say, okay, if you have this given at a standardized amount, so 25, 30 milligrams, we're pretty sure you're going to get, a particular effect from it. So I think that's encouraging. Or I should say beneficial. There's, many companies around the world now producing it synthetically or extracting it from the psilocybin mushroom. And I think there's also something, because it's been used for thousands of years, there's something very primal and very ingrained in human nature. That being said, also in animal nature, in regards to taking these particular, mushroom compounds. So, I think it's an instinctual desire, which makes sense. I mean, humans, we are very driven to understanding, to know, to connect. And I think this is an agent which allows for that.
Yeah, it's quite interesting because I know that you've studied kava a lot. You're studying medicinal cannabis. There seems to be a thread in that space of going back to your opening comment about the your desire to understand plants and why plants are so therapeutic as opposed to perhaps compounds that have been created.
Yeah, absolutely. I mean, look, this is my personal desire or passion or interest. I've always had a passion for nature and I love plants. And I can understand, people are very traditional pharmacologists, go through the pharmacy model that they want the isolated constituent and they want it to bind to just, one particular receptor, otherwise it's a dirty drug and, that's it. I take a different approach. I mean, I think, nature's the master chemist. The complexity of plants, the chemistry is absolutely undeniable. And, can we get the best of both worlds? Can we create medicinal agents which draw on the complexity, the potential synergistic interactions with these constituents, but then standardize them, focus them on, just a handful of compounds, but then not throw away the other constituents, which may have very subtle but powerful entourage effects. So that's my, my personal life's interest. Other people have other interests, for sure.
And I think it's very interesting understanding the history of these plants being used medicinally through generations and looking at why they were chosen and why they were used and what they were used for as well. So we see that with cannabis. Do we see that also with psilocybin? A history of use for therapies as a therapeutic agent?
Yeah, absolutely. And the same for ayahuasca, the South American plant combination as well. Yeah, absolutely. There's a strong tradition of historical use.
Yeah, and ayahuasca has obviously become, not a one-off. The ayahuasca parties and the use of psychedelics as almost a gathering and social experience. I mean, how do we navigate that? Does that mess up what we're trying to do in the medical space?
I mean, my philosophy is always an inclusive one. I think that there's room for both. If people want to go over to South America, have a traditional shamanic experience, then all power to them. I mean, as long as they know, as long as they're informed, they have to choose, I think, that pathway very carefully. I mean, we do know there's been instances of, issues of assaults, sexual assaults, crime around that. There are, you get a handful of charlatans. There can be issues if a person does have an experience like that. Let's face it, they're in the middle of the jungle. Is there medical care? Has there been appropriate screening? Is it right for them? Because it's not right. And we need to point this out. Psychedelics are not right for everybody, just like all medicines are not right for everybody. It's, it's something which needs to be considered. And then what about the post-integration? They've experienced this. I mean, we've got data, through our studies showing that a very small percentage, but nevertheless a percentage of people will have issues with integrating the experience into their normal lives. So there needs to be this support framework around that to make sure that it's done safely. So yes, there is that traditional option, but also we hope to advance, a more, for want of a better word, Westernized, psychotherapeutic model for people to have.
That's really interesting. I didn't even think of the post experience integration.
Yeah, absolutely. I mean, this is a bit of, I suppose, a strange divergence, but I used to live in Glastonbury in England. People may be aware of Glastonbury with the festival. And, I think I performed there years ago when I was, 18. I'd love to say I was on the NME stage, performing music, but we just did a little drama, a little theatre thing. And the experience I had living in Glastonbury, I mean, it was just crazy times and, really eye-opening experiences. And then when I came back to Australia, this time I lived in Brisbane, I couldn't fit in. It was very hard for me to relate to my peers, my family. It's like I came from another planet. So, people have these experiences, and this, I guess, with a psychedelic is a bit more of a condensed experience. But it can shake up their perception in terms of how they view the world. It can also change their relationship with people around them. Now, it can be a very good thing, but it also can be a very challenging thing. So, yes, we do very much need to have that integration support.
Wow. So this seems like that psychedelics actually in their use might actually change the way we are supporting people with either coping, using them to engage more in understanding the experience they're living through or their past lived experiences or future experiences. And in cancer, I can see that being really interesting. But then we have to also look at then developing an infrastructure to support those people post-experience.
Yes. Yeah, look, that's exactly right. It's not a case of just here, to have a trip and see you later, have a nice day, and that's it. It's the scaffolding around that particular treatment, and that's why treatment models and psychological care is so important. But also I'd go further and say, I mean, it's one of my own personal interests, as you know, in terms of lifestyle medicine. But these particular treatments marry up beautifully with some of our integrative approaches. So yoga, for example, mindfulness, meditation, breath work, the diet, the quality of a person's diet, and physical activity, exercise, sleep, lowering and having hopefully beneficial effects, lowering substance and alcohol use. So within that, more of that integrative paradigm, I think they fit very nicely, those agents.
So it's almost developing a whole plan of care from the start that you're having this experience, but a part of that support is introducing some of those ongoing therapies into life and lifestyle change to support their mental and physical health.
Yeah, look, absolutely. That's exactly right.
Wow. Well, and because we're going to close up soon, I just wanted you to say just a couple of words on, I know we haven't talked about microdosing at all. I want to just in 2 minutes, does microdosing sort of fit in here, or is that a whole separate topic? And then finally, do you see this as a whole way of changing our way of managing mental health in the future?
Yes, well, I think absolutely it's paradigm changing.
Yeah.
I think we still need to be sober and judicious in terms of how we see this being integrated in our medical system, and also advance the data. And it's very encouraging, but I think we don't want to get overly excited until further work is done. I mean, it looks very encouraging, absolutely. But in terms of microdosing, there's a little bit of research out there with that. It's the intention is, could, for example, if we use 1/10 of a dose of LSD or psilocybin, could we get mental health effects which are positive? I mean, people use it traditionally to have an effect on improving creativity, insight, maybe a bit of a mood boost. I mean, yes, possibly, but I mean, at the very least, we can see there are issues if somebody's trying to microdose and they're cutting up their LSD tab, or what are they going to do, breaking off half a mushroom gosh, it's just fraught with issues in terms of where we're at the moment in regards to just obviously safety issues. But look, there is the potential. I think it just really needs to be explored through more robust science. There was one study recently which came out which showed that microdosing didn't tend to have that much of an obvious effect over placebo in regards to mood changes. I mean, these people, it should be said, weren't clinically depressed, but there was, from memory, some positivity in terms of experiencing or increasing inspiration. For example. So, yeah, I think people are using it more recreationally. It's not something we're obviously getting into in terms of our scientific work, but yeah, the people are following that through.
Yeah, so I guess I always reflect on a patient of mine who decided that she had about a few weeks to live. She had dreadful metastatic breast cancer, and had worked with people with PTSD all her life, and decided that she was going to microdose until she died and report back to me every week of her experiences. And it was this with a guide. And for her, it was this incredible way of dealing with her existential distress of the meaning of her cancer has had on her whole family and her life. Not clinically depressed, not anxious, but found it to be so therapeutic. Obviously, it wasn't a legal process, and we've got a little way to go until this process is legal. But the idea that you can potentially change the way people live with advanced cancers, change the way people approach death and dying, and acceptance is, to me, it was, I learned a lot through her experience and our very interesting consults. But I think this is a really interesting space in cancer care, because often people aren't clinically depressed. They're not, they don't have generalized anxiety disorders. They're anxious and they're feeling down, and they're dealing with how to cope and with what's going on, and how I'm going to be able to move forward, knowing that I have a finite time, but I don't know when that time is up. And I think that the world of psychedelics is, and this option for cancer patients is going to be really exciting. I think the research in this space is going to be really, really important to help us work out, do we have a new therapeutic drug or process, or that we can introduce into expanding our toolbox of how this integrative approach to supporting people to live well with mental health and with cancer. So I'm excited.
Yes. And I'll just give a shout out to Dr. Marg Ross, who does this work down at St. V's, does fantastic end of life work, and the reports she gets back of some of the experiences for people with those end of life existential issues is staggering. So I think there's a heck of a lot of potential to relieve the suffering of many people. So
look, I think so. Thank you, Jerome, for your time.
Thank you.
Thanks for introducing us to a topic that I think all of us are really interested in understanding more about, and I'm sure there's a lot more we can talk about. But and so maybe we'll find a new time, a new topic, a new podcast in the future. And Jerome's T-shirt is covered in mushrooms, so we've watched Paul Stamets' fantastic fungi. It isn't quite the visual of that, but it is a hell of a good shirt. Sorry.
Thank you. No, I appreciate it. Oh, look, it's great to be with you. Thank you so much, Dr. Judith. It's been great. It's been a good talk. Wish you all the best.
Take care.